Unit 18 Psychiatric Questions 2 58. During a home visit, the nurse suspects that the young doctor of the client is bulimic. The nurse based the suspensions of which primary characteristic of bulimia? 1. Eating beans and purging. 2. Eating only vegetables and fruits. 3. Refusal to eat goo. 4. Hoarding of food. The correct answer is 1. Eating beans and purgings. 59. A nurse is taking to male client who has been diagnosed with post-traumatic stress disorder. During the conversation, the nurse notes that the client is exhibiting a paranoid state and is beginning to place an fidge. The most appropriate nursing intervention would be which of the following? 1. Allow the client to peace. 2. Share the observation with the client and help him recognize the feeling. 3. Escort the client to a quiet room. 4. Change the conversation to less threatening subject. The correct answer is 2. Share the observation with the client and help him to recognize the feeling. 60. A nurse is reviewing the record of the client admitted the mental health unit. The nurse notes documentations that the client experiencing flashbacks. The nurse would expect that this client has been diagnosed which of the following? 1. Agoraphobia. 2. Post-traumatic stress disorder. 3. Anxiety. 4. Schizophrenia. The correct answer is 2. Post-traumatic stress disorder. 61. A nurse is admitting a client with a diagnosis of post-traumatic stress disorder to the mental health unit. The client is confused and disoriented. During the assessment, the nurse's primary goal for this client is which of the following? 1. Stabilize the client's psychiatric needs. 2. Orient the client to the unit. 3. Explain the unit rule. 4. Accept the client to a personal and make the client feel safe. The correct answer is 4. Accept the client as a person and make the client feel safe. 62. A nurse in the mental health unit and having a conversation with a client diagnosed with post-traumatic stress disorder. The client seems upset and anxious. The most appropriate nursing response to the client is which of the following? 1. Don't worry so much. 2. Everything is going to be alright. 3. I can see that you are upset. 4. Why are you having so much trouble controlling your anxiety? The correct answer is 3. I can see you that you are upset. 63. A client with depression is scheduled to receive 3 treatments of electroconvulsive therapy. The client asks the nurse about the length of time that is required to show improvement in the condition. The nurse tells the client that after 3 treatment, improvement would be seen in approximately what period of time? 1 week, 2 3 weeks, 3 4 weeks, 4 8 weeks. The correct answer is 1 weeks. 64. A female client has been diagnosed with major depression and the nurse notes that the client is not eating adequately and at times refuses to eat. To meet the client's nutritional needs, the nurse plans to do which of the following? 1. Force foods and fluids. 2. Provides small frequent meals. 3. Provide snacks and meals as required. 4. Tell the client that social activities will be restricted unless food intake is consumed. The correct answer is 2. Provide small frequent meals.